Here we go. We're dealing with Project 2025. Everyone's talking about it. Now, I'm dealing with specifically the social services part of it. But if you want me to do more, I'll print out and do more. Goal 4, preparing for the next health emergency. Let me close the window. It's noisy. It's New York City. The COVID 19 pandemic demonstrated how catastrophic and micromanaging, misinformed, centralized, and politicized federal government can be. That's not what the problem was, but okay. Basic human rights, medical choice, and the doctor patient relationship were trampled without scientific justification and for extended periods of time. Excess deaths, not due to COVID 19, skyrocketed because of forced lockdowns, isolation, vaccine related mass firings, and colossal disruptions of the economy and daily rhythms of life. Again, that's not the problem. That's not why people were dying. Uh, and I think the economy was doing well in the sense, and most importantly, the environment was cleaning up, was getting better. And all you people that think that having a job is more important than clean air and water, and I don't know what to tell you. I just don't know what to tell you. If you're that dense at this point, after seeing this heat wave years after year after year, if you still think that it's either beneficial to have jobs than the environment or even makes sense, I don't know. There's no teaching you, and you're just done. Um, and people like you should probably be. I'm not gonna say that. The federal government's public health apparatus has lost the public's trust. Before the next national public health emergency, this apparatus must be fundamentally restructured to ensure a transparent, scientifically grounded, and more nimble, efficient, transparent, and targeted response that respects the unique needs and important and input of patient populations and providers. Everybody be dead. Everybody be dead under this thing. Every one of the overreaching, not that we live in it that much. I mean, the medical industry is killing so many damn people. Every one of the overreaching policies during the pandemic, from lockdowns and school closures to mask and vaccine mandates or passports, received its supposed legal justification from the state of emergency declared and renewed by the HHS Secretary. Tellingly, however, the threshold for what constitutes a public health emergency, how many cases, hospitalizations, deaths, etc., was never defined for the sake of democratic accountability. We must know with clarity what will trigger the next emergency declaration and, just as important, what will trigger its end. I mean, all you really had to do to slow the COVID thing down was, instead of putting, and most stores did this, instead of putting a limit on how much paper towels and tissue you could buy, they should have put a limit on how many masks you could buy and let everybody buy masks. What they did was the hospitals bought all the masks and left us with none. So we're coming in sick because we don't have no protection. And there's no way you can keep up with changing a mask every time you see a different patient. The things they were doing, the nurses and doctors were doing in hospitals and taping themselves up, and it was insane. Insane. And it exhausted them. And we said, oh, but they're working tirelessly. You're working tirelessly because you're doing dumb things. That wears you down. Doing thoughtless things wears you down. All they had to do was let us have the mask. We would have protected ourselves, and less people would have been coming in. And by the way, I know people who were making masks for healthcare workers. People were sewing masks for healthcare workers. So even if you would have let us buy them, but limited, healthcare workers could have still took half. When the COVID thing was over, healthcare workers in hospitals had piles of masks still in their in the hospitals. Unaccountable bureaucrats like Anthony Fauci should never again have such broad, unchecked power to issue health guidelines that will certainly be the basis for federal and state mandates. Never again should public health bureaucrats be allowed to hide information, ignore information, or mislead the public concerning the efficacy or dangers associated with any recommended health interventions because they believe it may lead to hesitancy on the part of the public. Sometimes that is legitimate. They believe that the public is so thoughtless and so savage that if they say something, all chaos is gonna reign. And they might not be wrong for that, but you still can't let that. You can't make your decisions based on that. That's irrational. You have to do what's reasonable and what's rational. And if people accepted the lockdown, they would have accepted anything. To be honest, people don't want to go to work. They hate their jobs. I see it on the trains. Everybody's exhausted and miserable. Now, why, when they had a chance to do something different, they went back? I think most people just felt like, I think most people felt like they didn't want to deal with themselves, with all the delusions that America was rewarding for them now, which your society's trying to go in a different way, different direction, like that. And it's hard to just flip a switch and go from deep delusion, bubble-headedness to clarity and to reality. That's not easy. The only way to restore public trust in HHS as an institution capable of acting responsibly during a health emergency is through the best disinfectants, light. One of the things that, and I agree with this, I think the pandemic was used to try to make a social shift. I actually agree with the shift that they want to do. There should be no more people with useless jobs. Right now, I'm going through something because I had to go through 3 different caseworkers to get something done. And I'm still waiting to get something done. And I know it's a job creation, but you could just pay. You can't tell me it's cheaper for the city, New York City, to pay each one of these workers $39,000 to take my email and shift it to the next person, than to just give that person $1,000 a month, or $1,200 a month, or $1,400 a month, and let them go find other work or do work by themselves, or find work where they can actually produce, or not work at all if they can live off that. There's nothing wrong with if you gave people $1,400 a month and 3 people got together and found a nice little apartment and wanted to live. What's wrong with that? What's wrong? Why do we have to grind ourselves down in the age of technology that we're in? It doesn't make any sense. Goal 5, instituting greater transparency, accountability, and oversight. Isn't that government? Oversight? And it should be oversight. The next administration should guard against the regulatory capture of our public health agencies by pharmaceutical companies, insurers, hospital conglomerates, and related economic interests that these agencies are meant to regulate. We must erect robust firewalls to mitigate these obvious financial conflicts of interest. If you need surgery, because right now to do surgery, every surgeon is graded based on their success. So surgeons are very serious about, some surgeons won't even do surgery on you if it's not at least a guarantee that they're going to come out, that you're going to come out of it. If it's a 50-50, most surgeons are like, I'm not taking that. That's going to bring my rating down. So if you need surgery, get it now, because if some of this stuff starts to go through, it's going to go back to the days where we were being butchered. Poor people, black people, whatever the case may be. All national, not that black people ever stop being butchered. All National Institutes of Health, Centers for Disease Control and Prevention, and Food and Drug Administration regulators should be entirely free from private biopharmaceutical funding. That's interesting. In this realm, public private partnerships is a euphemism for agency capture, a thin veneer for corporatism. Funding for agencies and individual government researchers must come directly from the government with robust congressional oversight. Wow. Is this right? This is supposed to be conservative. This is interesting. Complete government that will work. Complete government control of health, or at least these part of it. So you have your private insurance and your private things, and you have your public hospitals. We must shut and lock the revolving door between government and big pharma. Regulators should have a long cooling off period. This can't be right. Is this really Project 2025? This I got off the internet. Sounds right. The conservative promise. Regulators should have a long cooling off period on their contracts. 15 years would not be too long. That prevents them from working for companies they have regulated. Similarly, pharmaceutical companies' executives should be restricted from moving from industry into position within regulatory agencies. This sounds like a what should be a democratic point of view. Kamala might take this. Finally, HHS should adopt. No, she's not. She's a public-private person. Should adopt metrics across the agency that can objectively determine the extent to which the agency's policies and programs achieve desired health and welfare outcomes. Not agency outputs. What is not measured is not achieved. That's interesting. That's an interesting thing. I agree with that. That health should be government. And you can have private hospitals if you want. Private hospitals for people who have the money, and public hospitals. And of course you can regulate both. Or let the private hospitals regulate themselves. My thing is they probably will be good just because if they're not, the wealthy people are going to sue. I think it should be Medicaid for all, more than Medicare. Medicare doesn't cover dental and hearing, and I think which is insane because old people need those things. So it's a very backward society that we've created, and we've all gone along with it. We're all the blame. We're all the blame. You're the blame. I'm the blame. We're all going along with it. A lot of times I had no choice. Tried to push back and lost everything, so you end up getting stuck. But even with that, it's been government help. It's been government help that got me off the train. They did it in the most ridiculous way possible, and wasted an enormous amount of money doing it, but they did it. So I'm hoping that, or maybe that you're going to get a new set of mayors and governors and city council and things like that are going to say, wait, this whole way we do things, this waiting a year to get somebody from homeless into empty apartments, that's going to end. Put more responsibility on the individuals, on the people, and not having caseworkers everywhere. Again, with technology, we can upload files and documents in seconds, literally, and email them to where they need to go. Seconds. So we can scan documents and have them in systems in 24 hours on our own. We don't need to sit with caseworkers and go through things and fill. We don't. Those days are over. So those days are over in the hospital. I took an MRI the other day, NYU Langone, and I took it 12. I took my MRI at 12. Then I saw the doctor at 1:30. And when I was sitting waiting for the doctor to come in, ping, the results of my MRI was on my mobile device. And I opened up the file to look at it, and then the doctor got it after me. And while she was talking to me, I was telling her about it and reading to her from it. She got it and she was able to look, and we discussed it while I'm reading it. She's telling me what it is. The next visit will probably be a televisit. That's what she told me. I have to have another MRI because there might be a mass in my back. So we'll see. It's painful, but Black life is managing pain. 53 years of it. I mean 53 years of it. It seemed like I was born in pain. And I ain't the only one, I know. It's not a woe is me thing. It's just a sad. Matter of fact, I wish it was just me. It's heartbreaking to see how many people are broken in ways that are unrepairable. You know, and I'm going to go because this video is long, but I'm just going to tell you. I went out here in Queens, going to the subway, and it's like I'm near the last stop on the subway, so it's a lot of homeless people gather last stops. And you see alcoholics and drug addicts standing in front of the train station, the entrance and all that. I take the train, get off at 34th Street, and this black man is sitting in the middle of the sidewalk by Madison Square Garden, getting his works together so he can get high and nod off. He's just sitting in the middle of the sidewalk. Locks, no shirt. People are coming, going. 34th Street, Manhattan, right in front of Madison Square Garden. It's black people suffering coming, it's black people suffering going. It's a lot. It's a lot. It's very depressing, but it's the reality. And reality will assert itself. At some point, the suffering piles up, and we'll see what happens then. Take care. Be safe. Hit the links. I got a lot of stuff going on. Matter of fact, I have to go really work on my website. I haven't had the chance to do it this week. A lot of doctor's appointments. Making it better, tightening things up, putting more content, making it easy to get to the content. So I have my books there. I'm gonna put my videos up there. My prints, my 8x10 prints are there. So check it out. It's cool. Be safe, be safe, be safe.